Last Friday, Fortune ran an article headlined, "The U.S. is officially in a flu epidemic. Federal health officials say they're preparing to deploy troops and ventilators if necessary." The CDC announced flu hospitalizations are higher than they've been at this point since 2011's extreme flu season. For some inexplicable reason, which has the experts perplexed, the U.S. is seeing a resurgence of non-COVID respiratory illnesses like flu, RSV, rhinovirus, and enterovirus. It's almost as if immune systems are not functioning at peak efficiency, which are leading to this epidemic of random respiratory viruses. Let's look at some of the areas that are being hit hard. California's Orange County declared a state of emergency last week due to, in their words, an overwhelming surge in pediatric respiratory illness that's pushing hospitals to their limit. Children's Hospital of Orange County reported seeing upwards of 400 children daily in its ER. Fortune also reported that in our very own Canada, we're seeing similar problems, with some pediatric hospitals canceling surgeries. Last week, Children's Pediatric Hospital of Eastern Ontario reached 130% capacity for ICU beds and 134% capacity for inpatient beds. Now, to put that in relative context, given our very dysfunctional medical system, we're usually at 100% plus capacity all the time anyway. So while this is still high, it's not like we were at 50 or 60 and we went dramatically over. Dr. Anita Patel, a critical care doctor at Children's National Hospital in Washington, D.C., told Fortune that, "I can honestly say that unfortunately, with both RSV and the flu, we have had kids that needed to be intubated or have breathing tubes to help get through viral illness." She went on to say, "I've been practicing as an ICU doctor for a decade now, and I think I can safely say this is one of the worst surges I've ever seen." Now, for those of you who may be thinking that maybe COVID is the culprit, not so, according to Fortune. They stressed repeatedly it was not COVID. They're attributing it to all the nasty bugs that were displaced and are dominated by COVID during the pandemic. You see, their thinking is that they went dormant and now they've resurged. Now, of course, a story like this sometimes leaves one with more questions than answers. Questions like, given that historically flu affects kids the least, why this sudden increase in kids? Number two, why are their immunity systems struggling to cope more so now than previously? Number three, what else could possibly be behind the increase in the other additional respiratory illnesses as well? Has something changed with children's physiology in the very recent past? Number four, are there harder hit regions, i.e. states and or provinces or cities that are showing greater, obviously cases of this? Number five, is this a global phenomena? In other words, is it impacting all nations equally, or are some nations being spared? Number six, if some are now being spared or feeling very little impact, what's the common denominator, or what could we figure out as to why? Anyway, I for one don't have any of the answers, but am sincerely hoping that the medical experts will soon unlock this very serious mystery that's facing our children and the rest of us as well. Anyway, thanks for watching. I do appreciate it. Please post any comments you have in the comment section. You can also follow me on my Rumble and my locals. If you're new to the channel, subscribe. And if you're also new, check out some of the other videos. See you next time.